Okay.
Okay, so we are getting ready to start the microneedling treatment now. Trisha is numb. Trisha, you are numb, right?
Oh, very numb.
Okay. So we're going to go ahead and get started. She should not feel any pain. She'll feel the vibration of the needles, but she should not feel any significant discomfort. You doing okay?
Oh, yeah. The main thing that you feel, like Holly said, is just a vibration. And then it kind of feels like a rough microdermabrasion.
So when we say there is pinpoint bleeding during the treatment, not sure if you can see the little teeny tiny beads of blood, just actual pinpoint. Doing okay up here around the hairline, Trisha? And Trisha has requested that we don't go over her eyebrow area, so we're going to avoid that area. But I normally do like to go over the brow bone and lift up here, and I actually would go over this area to give some lift to the upper eyelids, but Trisha does not want that today. Still doing okay? I'm just going to do a little bit of a stamping here. You have a little raised area. I'm using a product called Lift that just provides the glide for during the procedure so that the needles are not dragging in the skin and ripping the skin. So we're really not disturbing the epidermis or the outermost layer of her skin. So this is penetrating beyond that, and we can go different depths depending on the patient's concern and what her skin type is. So we can really customize our settings. I'm doing great.
How long will she be red for?
So today when we're done, she'll look like she has a bit of a sunburn, and then tomorrow she'll just be a little pink. By the third day, typically, nobody would know you've even had anything done.
When can she put makeup on?
Well, with this treatment, we're creating those little microchannels, and they can remain open anywhere between 4 and 18 hours. So just to stay on the safe side, we tell patients nothing on the skin in the first 24 hours. Now, if she were going out tomorrow evening and just really wanted to wear makeup tomorrow evening, I would tell her just make sure that you've got your aftercare ointments on first. They'll act as a barrier also, and then she could use some mineral powder tomorrow if she wanted. But today she's not going to do anything. She's not going to cleanse the skin today. She's not going to wear any makeup today. She's not going to put any of her usual skin creams on today. Only what we sent home with her in her post-care kit. Still doing okay?
Yep, doing well. Feels good to be pampered.
So we see these little tiny beads of blood coming up, and she's red, and that's what we want to see. Some people find the nose area to be a bit tickly. It can make you sneeze too sometimes. But this really does help with the pores. So if enlarged pores is a concern, this is one of my favorite treatments for that. You doing okay on your nose?
Oh yeah, it's just a little ticklish.
Okay, so we'll show her when she's finished.
Okay.